Hello, I'm Connie Foster, and I want to thank you for joining us for today's Chancellor's Chat, 2 minutes of important campus updates. Today we are sitting out in front of Hagstead Hall, and my guest today is A.Z. Snyder, Director of Pierce County Public Health. Well, A.Z., it's nice that you could join us. I know you're extremely busy, and I do want to ask you, students are starting to come back to campus, and we will start testing. So could you tell us a little more about the type of testing that we will be doing? And the importance of students getting tested if they aren't feeling well.
Sure. So there are two types of tests that will be available on campus. The first is antigen testing, and this will be used at point of care for symptomatic students to get a fast test result, and it will be used for some asymptomatic surveillance for students that may not be feeling sick, but we want to test anyway to get a sense of the level of disease on campus. That test result really looks for proteins in someone's body that indicate that they may have had COVID-19. The other type of test is a molecular test called the PCR test, and that actually looks for fragments of RNA from the virus, and that is a diagnostic test that is much more definitive, but it's more expensive and it does need to be sent to a lab out of county, so we use that only for symptomatic students.
Great, thank you. My next question is, what does the local health department do when there's a positive case of COVID-19?
So when there's a positive case of COVID-19, the provider that tested the student or the staff member is going to report that positive test result to the county of residence for that person. The health department then receives it, and we call the person to conduct a disease investigation. We ask a lot of questions about when they develop symptoms to understand where the source of the infection may have occurred and what time period they were likely infectious. We then turn over the student to the UWRF contact tracing team to understand who they may have been around while they were infectious. The contact tracing team then reaches out to close contacts to notify them that they may have been exposed to COVID-19 and that they need to quarantine and get themselves tested if they do develop any symptoms. We then case manage the case for as long as they're infectious to make sure that they have everything they need to safely isolate.
Great, thank you. And what can students do to help local public health?
So local public health is, we want students to come back. We're really excited. This is the lifeblood of the River Falls community. And so we're really invested in having the university start again. But we need everyone's help to make sure that we're successful this fall. So I'm asking students to please keep your groups small, keep your circle small. Have a small group of friends who are the consistent people that you hang out with. And if you have symptoms, even if they're extremely mild, please go get yourself tested. Testing is absolutely important. It's how we detect disease on campus, and if we don't have that testing piece, all interventions will likely fail.
Great, thank you, AZ, and thank you for taking the time out of your busy schedule to join us today and answer a few questions. I do want to say welcome back, students. We're excited. I know a number of the residence hall students arrive tomorrow and throughout the rest of the week, so we're looking forward to seeing you. Thank you, and Falcons forward.